My name's Deborah and I'm a joint replacement specialist nurse. I'm part of a team of 4 nurses and 1 nurse in training who are responsible for the pre-op care of joint replacement patients and also post-op and review care. We are quite a unique specialised team. There probably isn't, well, we know there isn't a team across this region who actually does the work that we do. We're a fully autonomous service, totally nurse-led. I'll talk a little bit about what we do pre-operatively for patients. The first point of contact when a patient is placed on the waiting list for joint replacement is with us. We run an education class weekly where we talk to patients about expectations versus reality, what to expect from their surgery. We show them the joints. It's a good starting point for patients, the patient's journey, as it helps them understand what exactly is going to happen to them. We then have an individual one-to-one appointment with patients just prior to their operation. This is quite a clinical appointment. We do fully examine the patient, we prescribe drugs for the patient, but also it's an important appointment so patients can tell us their concerns or any worries or problems that they have. We do investigations at this appointment also and follow those up. So we liaise constantly with all members of the MDT, GPs, other consultants in other specialities, physios and occupational therapists. The patient is admitted to hospital within 2 weeks of that appointment with us, the nurses.
Once patients are discharged from the wards following orthopaedic surgery, we give them a 48-hour discharge call just to check their progression, make sure they're meeting the milestones, they've got pain well controlled and they're managing to carry out their exercises. We give them a contact number for the first point of call if they've got any concerns, which is a direct line to our service. It's Monday to Friday, 8:30 till 4:30. The next point of call is a 2-week wound review where we review the wound following the surgery. We check for infections, we also check for swelling, DVTs and the exercises that they're carrying them out correctly. If there's any concerns at this appointment regarding their surgery, we do refer them on to services, but we also carry out extensive investigations including DVT referrals and taking bloods to see if there's any infections. The next point of call would be a 5-month review with ourselves, which is a telephone review. However, the patients do return for an x-ray at this point, which is reviewed by ourselves. We then contact the patients with the results, and also if they've got any concerns they can highlight it at this review. We then review patients at a 12-month review. Again, an x-ray is carried out. We can discharge patients at this point, however we do keep some patients on it for longer treatment. We also carry out a metal on metal review clinic, which patients were recalled due to metal on metal implants being inserted. These patients have a check of blood results and an x-ray. If there is any concerns at this point, we do refer them back to the orthopaedic consultants, and some patients do require revisions at that point.
The care I've received has been unbelievable. In actual fact, the Homeward surgical nurses team have been unbelievable. Prior to my actual operations in each case, they took me through it, exactly what was going to happen, and then afterwards, after having the operation and going home, I got the aftercare that was necessary to get me back on my feet and out and about again.